A clinical trial in St. Louis for a COVID-19 vaccine is looking for more of you to volunteer. Good evening, I'm Samantha Jones.
And I'm Corey Stark. Steve has the night off. But what's most needed, people in high-risk minority groups. News 4's Russell Kinsall is live in Midtown detailing the call for community help. Russell?
Well, right now we're outside the building that houses the SLU Center for Vaccine Development. Researchers here say they need more people from certain minority groups to sign up for this clinical trial. Specifically, they're looking for African Americans, Hispanics, and Native Americans, population groups that have been hit hardest by the pandemic. Even the head of the pandemic task force is stepping up to help out with the research.
Got it in my left arm, non-dominant hand.
Dr. Alex Garza, St. Louis Pandemic Task Force Incident Commander, signed up to be one of the 30,000 who are needed nationwide for the clinical trial on a coronavirus vaccine.
I'm an advocate for vaccinations, obviously. Vaccinations have to be based on best science. And so I felt like this was my small way of contributing to the science for a safe and effective vaccine.
The SLU Center for Vaccine Development is one of a number of sites across the country running a third phase clinical trial on a vaccine developed by Moderna. This is video of the center before the pandemic changed their protocols. Right now, they're encouraging more minorities to sign up.
This is important to us because enrolling the right folks from these different populations will allow us to figure out whether this vaccine works in the people who really need it the most.
Principal investigator Dr. Sharon Fry said enrollment will continue for several more weeks. And then it takes time to monitor the participants to see how many who get the placebo contract the virus and whether anyone who got the vaccine gets infected. So it's not realistic, she said, to think that this vaccine could be ready this year.
I would tell people that they have to be patient and let the process run its course so that we can get the data that we need to make a sound decision.
So consider this, it is scheduled to be a 2-year study. But that's not to say that even earlier than that, the FDA could say there's enough proof that it's safe and effective and then give approval for it start to be used for the public. Live in South St. Louis, Russell Kinsall, News 4.